The tragic death of Dr Alulutho Mazwi, a young medical intern at Prince Mshiyeni Memorial Hospital, has really shaken South Africa's healthcare community and sparked national outrage. At just 25 years of age, Dr Mazwi reportedly died whilst on duty after repeatedly asking for time off due to illness. He allegedly asked for time from his supervisor so that he can rest, but it was refused. This is not just a tragic story, but it's also a red flag waving over a system many say is broken, where doctors, especially interns and juniors, are said to be overworked, unsupported, and too afraid to speak out. So joining me for this conversation this afternoon is Dr Mvuyisi Mzukwa from the South African Medical Association, as well as Mlungisi Ndlovu from the Public Servants Association, the PSA. Both, well, it's an organization, of course, that has been raising the alarm over mistreatment and abuse inside hospitals for years now. And so both join us virtually at the South for the conversation. Good afternoon to the both of you. Thank you. Thank you for making time to chat with us.
Good afternoon.
Thank you. Thank you for having us.
Mlungisi, let me start with you. Perhaps you could just tell us what really happened to Dr. Mazwi in those final days. One of you also heard from his colleagues who were obviously on the ground and privy to what happened in real time.
Good afternoon to the viewers at home. Firstly, I want to continue to send condolences to the family of Dr. Mazwi. What has happened at Prince Mshiyeni reminds us of the apartheid systems which ill-treated our people. It's even becoming so difficult what has happened at Prince Mshiyeni, where we expect the employer to protect the employee. The ultimate death of Dr. Mazwi is a clear indication of the collapse systems in KZN in particular. You cannot have a situation where a doctor reports that I'm not well, and you could see his walk that he was not well, he was not moving well, and he sent the communications to the land manager to say, I'm not well. But the land manager said, I want you on duty. As a result, he has passed on. The painful message, if you look at that particular message, you communicate and you get a response. And what's surprising is that all the interns, they say the same language to say we are being abused in this particular hospital. As PSA, we believe that the life could have been prevented. And we believe that the Department of Health has failed its constitutional duty to protect the frontline workers, because PSA, we've got so many doctors and interns who are our members who have been on record. When we won the department, we went and handed over a memorandum. Because PSA is not politically aligned, we're ignored. Even the response of the department is not enough in attending the issues. We're still very disturbed that we have not, as union, been called by the MEC and also authority for them to visit the institution. The situation at Prince Mshiyeni is so terrible, bad. And we have engaged with the interns. You could see from their eyes to say they are not happy with the situation. That's why you are saying...
Mlungisi, let me come in there, and thank you for speaking to that. Just before I bring Dr. Mzukwa into the conversation, because one life lost is one life too many, but this is not an isolated incident. The PSA also spoke, about the late Dr. Francis Idika, another doctor who allegedly endured sustained harassment and bullying before his own untimely death. And I wonder if we could just speak to, what these cases tell us about the working environment in public hospitals, mitigating against life or death crisis, of course, given the nature of their work, but the pressures, the burnout, the realities that they face on an emotional level as well.
So the challenges in the health facilities, as you have mentioned, the issue of Dr. Iding in Friday, whereas PSA, we went there and picket, we sent a memorandum. Till today, the department have not responded to us. We are saying the environment is so toxic in such an extent that many of the frontline workers, including nurses and others, they are being abused. If you look at the workload of the doctors, it's very excessive. They work between 26 to 36 hours per shift without rest. They are expected to make decisions. So, and we believe that these interns, they are supposed to be supervised in terms of law. And the information that we receive that there's about 16 vacancies of budgeted posts. And CEOs are being prevented to fill this particular post, mainly because the department is in deficit, they are facing financial challenges. So some of the information is that when they report to their supervisor, they are being blue tick. They are expected to look after intensive care unit where there are many patients, life-threatening patient in terms of providing this support. And by law, that is illegal. It is because a public sector has faced chronic illness, what you call shortage of staff, of doctors and nurses and everyone. Now they rely on these interns. They are not only abusing interns, even other medical doctors. It's not only the question of Prince Mshiyeni. You go to Dr. you've got a case. You go to Benedictine Hospital where one of the medical intern committed a suicide. You're going to Eddington where a medical doctor disappeared and died. You go to Potchefstroom where a radiographer was found dead. We are saying the system failed. And as members of the PSA in the province, we're saying it is time for change. So they need to be able to provide leadership. And we expect the minister not only to call for intervention and the premier, they must be able to make meaningful investigation, because members don't believe that department can investigate themselves. In the past, they've shown that they are unable to do so. They are continuing to disregard this particular profession, which is very critical for the service. So we're receiving many calls. All the hospitals now, people are saying we are in trouble, we need assistance. It can't happen in our name. That's why as PSA will start this particular journey.
Thank you, Mlungisi, for weighing in there. I just want to also welcome our other guest, Dr. Mzukwa, into the conversation. And Doc, thank you for making time. We've heard the sentiments being echoed from PSA. And just from your perspective, if we're looking at the impact that chronic overwork and emotional stress has on doctors, particularly young interns just starting their careers, capacity building. I mean, we're obviously seeing the way the system has been constructed and the ripple effects, into how, these cases are coming to the fore, concerns as well, holistically, due to the wellness of these doctors. How would you like to weigh in?
Well, first of all, I would like to say good afternoon to you and to my colleague there from PSA and to our viewers. And thank you for having us in your program. I think, first of all, I would like to take this opportunity then to convey our sincere condolences to the family, Mazwi's family, the friends and colleagues who worked with him at Prince Mshiyeni. We really feel that, the passing of one of our colleagues, Dr. Mazwi, whose death really serves as a brutal reminder of the daily abuse, threats, bullying, and intimidation that is so inherent in the medical field, and the brand of which, unfortunately, is being borne by interns and students. We have met with the interns at Prince Mshiyeni, who voiced their concern, and we encouraged them to write down or put down a memorandum that was handed over to the management of the Prince Mshiyeni Hospital. And secondly, the South African Medical Association, as a representative body of doctors in South Africa in the public sector and the private sector, we have also written to the HPCSA, our regulatory body, to say, go down to Prince Mshiyeni and do an investigation there and find if Prince Mshiyeni is really in a position to supervise interns. Do they have enough senior doctors in the posts to supervise doctors, these interns? Because we know that interns are not a workforce. They are supposed to be supervised. There should be somebody on duty, and they cannot fill the posts, the spaces that have been left vacant deliberately by government when they're trying to save money instead of saving lives. This is what we see when a government is saving money and not lives. We see healthcare professionals who are taking a branch and who are really dying in the system. So
Dr. Mzukwa, let me come in there, because obviously, given South Africa's structure or how the healthcare is structured, there's a two-tier system, private and public, and obviously, with ongoing talks about NHI in the works, we're looking at the impact that this structure's now had on doctors and their performance, job satisfaction, mental health, amongst some of the other crises that they're mitigating through the job itself. And if you're looking at interns as well, who, as you alluded to, are not, a workforce per se, the mechanisms that exist to protect junior doctors who are being mistreated, even interns who are being overworked, and how those systems are working in reality. Yes, there have been calls from the HPCSA, but what's happening on the ground as we speak, especially if, some are too scared to come and voice their concerns?
Well, what we have heard from the interns when we have a meeting with them is that there is a serious bullying that is happening, from the hospital, but also the fact that they are overworked. They work long hours. They can go 36 hours, all at once, and you find that they don't have time for breaks. They don't have time to refresh. They don't have time, even to replenish, their energy levels. So that is what is happening at Prince Mshiyeni and the other institutions across the country, by the way. So we feel that instead of government putting in place, the human resources for health plan that they've drafted long time ago, and that is gathering dust, in their shells. We feel that it is time that people should realize, and all South Africans should realize, that we're at the rock bottom when it comes to healthcare in our country. This country is failing South Africans. It is failing employees. It is failing doctors and nurses who are working hard, and the serious troubles that they're facing at the moment.
All right, thank you, Dr. Mzukwa, for weighing in there. I just want to bring Mlungisi back into the conversation now. So beyond, the ratio of doctors to patients that we're obviously seeing in our country and that mismatch there's also, the issue of resources. And I wonder if we could just go back to Dr. Mazwi's case, reportedly having, reported that he was visibly unwell, and yet he was still pressured to work. And so we're looking at that culture that's perpetuated, interns being too afraid to speak up, bullying allegations as well. The reports also suggesting that he feared being forced to repeat his rotation. Is this kind of fear and pressure something that your members report regularly? What is, that reality on the ground?
The reality on the ground, because PSA, we're not only talking about statistics, we represent these doctors on a daily basis. And one of the issues that have not been mentioned is that at Prince Mshiyeni, the doc presented a medical certificate and to indicate that he was not well, but he was forced to be able to work, which is against the Basic Conditions of Employment Act. That's why we've asked the Deputy Minister of Employment and Labour, Honorable Jomesbia, to visit that institution. We've also asked Compensation Fund to be able to go there and investigate, because we believe that what is happening at Prince Mshiyeni is not only the doctors. We've got 28 nurses at ICU. When they take sick leave, it's get rejected. They were charged because they were bullied by the management. And the reality also of Prince Mshiyeni, they say this a population of about over 700,000, which is above Ugu district on the south of KZN. So Prince Mshiyeni is supposed to have a feeding district hospital. It only have 18 clinics. All the 18 clinics, they are pushing patients to Prince Mshiyeni. And if you look at areas like KwaMashu, they've got more and more. Ugu district, for example, they've got 3 hospitals. I'm saying this is a legal violation. That's why we said public protector must be able to be involved. Because if public protector is not taking initiative to investigate, it's not all about the death of the staff, also the patient rate. You must go and get statistics, how many patients that are dying there who are not supposed to die, mainly because the staff, they are overworked, they are over-exhausted. These These medical interns are not allowed to rest. So that's why we are saying it's time for change in KwaZulu-Natal. We cannot be able to breathe anymore. It is for these reasons that on Tuesday we'll go back and picket in that particular institution. But picketing is no longer enough. We'll get legal opinion to ensure that those that violated the constitutions, there is an action. There is shortage of medications. You know, in our province, when these things get reported, there is PR cover up. Our people are dying. Most of our leaders use medical aid, use private hospitals. They don't experience this. That's why as PSA, we are saying all the doctors must unite, frontline workers, because it's about everyone who are being bullied at the workplace. We call for an independent commissions. In actual fact, the members are saying the president has power to institute commission to look at the public health in South Africa and look in terms of the research, because if you look at section 27 of the constitution, talk about the right to access to healthcare services. But how can you have access to healthcare services without enough capacity? So the issue of Prince Mshiyeni, they need mental support, and the MEC.
All right, Mlungisi, I'm going to have to leave it there. Thank you for weighing in. Of course, Mlungisi Ndlovu weighing in from the PSA Public Servants Association, as well as Dr Mvuyisi Mzukwa. He represents the South African Medical Association.